So I'm very happy that you're able to join me today.
I'm so happy to be here.
You're a woman of many talents. You're a clinical psychologist, number one. Your primary interest is in the intersection of psychology and media.
Yes.
You're a professor at George Washington University.
Yeah.
You have a private practice.
Yeah.
You host a TV program, The Healthy Mind.
Yes.
You are a contributor to The Medium, to Huffington Post, and other media outlets. And you're an author of Best Psychology in Film. That's quite a list. So where do we start?
From my experience with working with patients, there was an enormous amount of fear. Individuals struggle with feeling safe, concern, panic, fear of going outside. And I want to highlight, for some people, they were feeling very hopeless, ineffective, feeling like they had no self-efficacy in ways that they felt before. Some people were furloughed and or lost their job positions. And so there was a lot of feelings of sadness and grief. Some individuals had escaped a social economic system and they lost their jobs. Now, without this income, where will that leave them? And will this place them back into a situation financially that they had just was able to get out of?
In an article that you recently wrote for The Medium, you talked about how dreams can be quite bizarre, vivid.
I'm very much a Freudian type of psychologist, very psychoanalytic, psychodynamically trained. With Freud, he indicated the dreams provide us this wonderful opportunity into our subconscious mind. And many times we feel like, oh, they're random, and yet they're quite intense. He believed it's our mind trying to work out these conflicts that we're experiencing in our everyday life.
What would you recommend to both employers and employees about handling, do you feel safe? Because they may feel like, well, I better not say anything.
Oh, we have to say something. One of the things that I would recommend employers do is ask their employees, what are your concerns? And address COVID issues as frequently as possible, whether that's sending out an email of updates regarding COVID within their area and how they plan to address it, and be very specific in those details. Do you plan to take temperature reads every morning? Do you plan to be able to account for the types of symptoms that people are experiencing? If those things come up elevated in any way, what are the next steps? Where should they go? Do they get screened? Do they get tests? Where are those places that have agreed to do that? What are you requiring of your employees? Are you requiring them to wear cloth masks, surgical masks, N95 masks, a face shield based upon their level of exposure? Being very specific. How do you plan to social distance? In what capacities? How many people can be in a room at one time given a specific diameter of the actual layout? Being very clear. Those specific structures can help reduce anxiety significantly, and it helps the employee understand that my employer is thinking about all of the things that's going to make me anxious about coming back to work, and they're putting things into place for me so then I can be safe and feel safe coming back.
How would you advise people in creative fields or people who identify their worth with their work who are out of work?
This is a very complicated question because as an artist, it is a part of you. We get to see parts of them in such vulnerable ways through their work. And so it's hard to be able to respond to that question of how do we separate, let's say, their work and worth from their identity, considering their work is a reflection of their identity.
Yeah.
And so I think we don't ask them to do that. It doesn't take away from who they are. It just means at this moment, individuals may not have the capacity, the emotional or mental or even cognitive capacity to be able to appreciate them the way they deserve to be appreciated.
It seems as though there's two kinds of responses. There's those people that are creating something probably as a distraction and to keep themselves busy. And then there's other people who are choosing to be very quiet.
Yes, and we all need different things. People are maybe doing what we're doing right now, which is creating something, and we're creating something for the public, and hopefully it's helpful. And actually, this is really healthy. What's happening between you and I is actually considered a defense mechanism, and it's not distraction. I would not minimize it to distraction. This is called sublimation. It's the highest level of defense that we think about. And this is when there is a crisis or when there's a problem, the way that people manage it is through taking in the information they have, being curious, and creating something for not just us to be able to benefit from, but hopefully other individuals too. Purely healthy. And then there are some people who go silent and they need to take stock in where they are and understand their affective experience, understand how they're coping, be able to self-evaluate during this time, be able to regain some controls in their lives in ways that they may not have had time otherwise. And that too can be healthy. But then there is a silence that we should be concerned about. And that's a silence of an individual who's withdrawn, who feels like they're alone in this, who won't connect, who's feeling, again, depressed or helpless or hopeless. And they may look sad. They actually may look unkempt. A feeling that the person's will is diminishing, have increased their appetite and therefore may be gaining weight, gross loss of weight. You may see that they're tired, oversleeping, unable to sleep. They may not be willing to consider options of how better to take care of themselves. The person really struggles to be able to sit still, feeling that they are restricted because of their fears, like they won't be able to leave their home.
In your 2018 book, Best Psychology in Film, you encourage a dialogue to consciously experience what we've subconsciously witnessed watching the film. And it is really fascinating.
Thank you. This is my passion, truly. I love all of the things that I choose to do within my career, and I'm very thoughtful about what I do in my career because I want to love it. And this aspect is certainly one that resonates with me most greatly. On one hand, I'm able to actually work with screenwriters and directors and actually come at it at that point of view, where before it actually is even made, before the actors come in, we can begin to develop these characters into ones that genuinely represent the complexities of the human condition. And on the other hand, I get to use psychology in a way to educate the public regarding what we're seeing. So hopefully my writing, whether it's with Thrive Global or with Medium or within this book, we can actually think about psychology in a way that's demystified and learn something about ourselves by watching media. All good characters are complex, and not all one character is all good or all bad. The ones that are really developed psychologically have these nuances about them that we try to figure out. Why does this cause me some level of distress watching this character? Or why do I love this character so much and they still did this bad thing?
And then having the mental health discussion about how a certain character has made the decisions they've made as a result of what's come before. It can reveal a lot about our own choices.
We can learn how we cope with issues, how we choose not to cope with issues, how we don't want to cope with issues, alternative ways that we can manage conflict, the way we understand the world, how we navigate in the world, and what's going to feel good for us.
Are you going to do another book?
Maybe I will. And I have one in mind, and because of our social climate, not just our health climate, I am thinking about how African Americans are perceived in media, specifically in films, over the course of X amount of years, which I have yet to decide, because I do think it's important to do the same sort of analysis, in particular to my community that I identify with, and how the media has helped shape some thoughts, opinions, even values that people have regarding people of color. And some of those things are perpetuated through the media, both good and bad.
Do you teach a course on psychology and film?
You know, I don't teach a course in psychology and film yet. Once a month, I do host a film series. I hosted at George Washington University, and all are welcomed. And we are now collaborating with the Washington-Baltimore Center for Psychoanalysis. We bring in films and we watch them together, and then we have a psychological dialogue. What the characters were thinking, the themes, even understanding set accuracy. Why was the set actually constructed this way in order to help us feel the way we did? Or why is this cup sitting on this table in order to evoke something in us?
Have you thought about directing yourself?
We'll see.
COVID and Black Lives Matter movement. I just wondered if you'd like to touch on that.
Mm-hmm. You know, it's a very interesting time where two things are intersecting that are very important, and really are life and death issues in both ways. And they're intersecting in such an uncommon way, or at least what I view as to be an uncommon way. Here we are with COVID, which is an immediate crisis, an acute one. A new crisis is intersecting with something that's a historical crisis for the community of people of color. And it's this movement currently, the aspect of Black Lives Matter along with police brutality, it's happening at a time when people have the space and time to be able to move. They were home previously, and some of them were anxious about leaving their homes. And yet, here we are in this another crisis, a historical one again, that's created movement in people and have allowed them to put aside their fears of COVID for a specific amount of time to act. And so we have these massive protests of people coming out because, again, there's time and space to do so. And it's an important cause. And so the challenge is making sure, of course, protests is happening safe, without hopefully increasing the risk of being exposed to COVID. And we know that that is a risk of protesting at this point, and that people are willing to put their lives on the line in that way, because really, as a person of color here in the United States, your life is already on the line because just what you look like. And so which one will you do? Which will you not walk and be a part of protests in some ways, or and contribute to this movement in some ways? And what is it worth? And for all of the people out protesting, it's a very clear message. It's worth contracting COVID for. And this is a problem that we have experienced long before my time here on this earth. I hope it is extinguished before I leave this earth. And this is such an important cause regarding how we think about humanity and how we work and again, interact with being humans on this earth. And hopefully we've gotten to a place where it's a crucible of this will be a change, because we've seen the fact that it's kind of been a crucible, that the unrest that is being felt at some points, and even protests that have been hostile and violent, it really is a symbol of that we cannot continue this way. And so I'm very hopeful change will happen sooner than later, and understanding that the change is very complicated change. Who needs to be involved? Everyone. This isn't one person's issue or one community's issues. It's everyone's issue. Again, this is a humanity concern. And so it definitely is intersecting with COVID in such a unique way. But I'm hopeful because of that, we continue to see massive individuals protesting, and hopefully in a peaceful way, to be able to continue to say that we cannot continue to live under these conditions.
Thank you for sharing that.
Sure. And thank you for asking. You know, one thing that I do take very seriously is that as a person of color, and I identify as such, is that there is a level of consent to have these sorts of conversations, that understanding that having these conversations as a person of color can be very difficult. And so I really appreciate you asking and gaining my consent to have this conversation before doing so. So I really appreciate that.
Oh, well, I'm so glad that we're having this conversation.
Well, again, I appreciate you bringing this up. I understand this is outside of the limits, even of COVID in some ways. And yet, it is certainly another crisis that lays burden for individuals right now. I live in Washington, D.C. And so the adjustments that need to happen related to COVID and just remaining safe and wearing masks and how do you wipe your hands and your hand sanitizer and all of these things that's required of you now, that is an emotional burden and it's taxing on our executive functioning skills. You have to plan and organize and be thoughtful in ways that you weren't needing to be previously. And then we have protesting, which means we have road closures and where can you go and at what times and do we have to follow the curfew and what does that look like? So there's all these emotional demands that are external from us that's impacting us all at the same time. And so as COVID is happening, Black Lives Matter movement is also happening in a very strong, meaningful way that are both equally important to discuss at the same time.
And I'm so glad you're here. Thank you. It has been an absolute joy getting to know you a little bit better.
Thank you so much for having me. It's been truly my honor.
All right. Well, we'll be in touch.
We will.
Bye.
Bye.